Foot tie-in spleen meridian. We will talk about spleen 9, Yinlingquan, Yin Mound spring. Spleen 9 is located on the medial side of the leg in the depression posterior and inferior to the medial tibial condyle between the posterior border of the tibia and the medial head of the gastrocnemius muscle. This is a water point and a Hussey point. The knee is thought to resemble a hill or mound. This is a water point or spring nearby the mound. The spleen transports fluids, and the water element controls and stores fluids throughout the body, mind, and spirit. This point helps regulate the balance of fluids within the spleen. Excessive damp impairs the functioning of the spleen, causing accumulations of fluids or a water-lagged mental level. Thinking becomes woolly and blocked. Forgetfulness occurs, intent is lost. Conversely, the body, mind, and spirit of the spleen needs sufficient humidity in order to function. Water brings the power of original chi to the spleen, helping it get moving and to feel strength in the limbs, but also granting the repose of its influence, lubricating thought, strengthening memory, enabling fluid responses to changing circumstances. Spleen 9 presents an opportunity to root the person's chi in yin. This can help alleviate perpetual anxiety and quell the restless neediness that seeks attention, support, and nourishment from others. Conversely, it can moisten a crusty exterior that pushes others away while hungering for emotional, spiritual barrenness to be relieved. It helps the spleen see its own harvest or meet its own needs so it can adjust its giving or withholding in relation to others to a more reciprocal level. Yin Mound spring point can bring the refreshing, soothing, restorative properties of water to the spirit. As a Hussey point, it can be used for stomach and intestinal disharmonies, and as a water point, spleen 9 clears damp, especially from the lower jiao. Difficult urination, retention of urine, diarrhea, edema of the legs and abdomen. Piroge describes it as a kind of acupunctural diuretic, increases urinary flow, and is useful in disorders which might be alleviated with increased output of urine. Useful in Dampness of the knee where there is accumulation of fluid. Indications: calms the mind, helps regulate fluids and clear damp from body, mind, and spirit. Intestinal disharmonies, Dampness of the knee. This water point can be used to regulate the balance of fluids within the earth. It can be effective if the earth has too much water in it and has thus become waterlogged. This presence of excessive damp can not only cause edema of the legs or abdomen, retention of urine or diarrhea, but can also result in being mentally bogged down or woolly-headed. The patient may crave sympathy or understanding, which can be indicated by their need for others to feel sorry for me. Can be excellent for knee problems, along with stomach 35. Tenderness of this point can, on women, may indicate hormonal problems. Indications and potential point combinations. Knee pain, spleen 9 is combined with spleen 10, stomach 34, 36. Depending on the location of pain, check for trigger points in proximal muscles. For popliteal pain, palpate hamstrings in the bladder 36, 37 region. Quadriceps triggers can send pain along the stomach and spleen channels. Check spleen 10 in the vastus medialis for cranial knee pain. For edema of lower extremities, venous insufficiency, spleen 9 together with spleen 8, 10, CV6, stomach 36. Evidence-based applications. Unilateral acupuncture for advanced osteoarthritis of the knee was effective as bilateral acupuncture using spleen 9, 10, stomach 34, 36, and LI4 on the ipsilateral hand. Acupuncture at bladder 15, 23, 32, GV20, heart 7, PC6, liver 3, spleen 6, and spleen 9 significantly improved postmenopausal hot flashes and sweating episodes. EA at bladder 23, 28, spleen 6, and spleen 9 in combination with manual acupuncture at PC6, TH5, and GV20 induced regular ovulations in some women with polycystic ovary syndrome, thereby offering an alternative to pharmacologic induction of ovulation. Acupuncture at CV3, bladder 23, bladder 28, kidney 3, spleen 6, 9, liver 2, or liver 3 provided effective prophylaxis of recurrent lower urinary tract infection in adult women. EA at bladder 23, 28, spleen 6, and 9 in combination with manual acupuncture at PC6, TH5, and GB20 is very effective for PCOS. Following a series of acupuncture treatments, men with poor quality sperm experienced a significant increase in fertility index following improvements in the parameters of total functional sperm fraction, percent viability, total motile, spermatozoa per ejaculate, and integrity of the axonema. 12 acupuncture points from the following group were selected according to patient presentation: lung 7, LI 4, 11, stomach 30, 36, spleen 6, 9, 10, heart 7, bladder 20, 23, 33, kidney 6, 7, PC6, liver 5, 8, CV1, 2, 4, 6, and GV4. Thank you for your attention.